It's my pleasure to introduce our next speaker, Dr. Donna Evon. She is a clinical health psychologist and behavioral researcher who's worked in the field of chronic liver disease for 20 years. She's a professor of medicine in the UNC Liver Program at the University of North Carolina at Chapel Hill, where she helps understand the psychological, social, and behavioral factors associated with liver disease. Her work's been funded by the NIH, PCORI, industry, and significantly PSC Partners. We'll be talking a little bit more about that to really help understand patient symptoms, the patient experience. We've talked about it a little bit earlier about fatigue in PSC. There are other significant symptoms associated with it. We have some exciting new tools around communicating those experiences. Thank you, Dr. Evon.
Thank you, Brian, and thank you, Kittist and PSC Partners for asking me to come and talk today. I'm really excited that I'm getting to talk in the afternoon because, like Brian mentioned, this is a perfect segue into what I'm going to talk about today. Okay. So I've got 6 talking points. So we've talked about, I actually think John asked a question about the fatigue measure, and Darren from Mira may have given you the kind of definition of a PRO, but patient-reported outcome measures. A report directly from the patient without interpretation from a clinician or anyone else about your own subjective experiences. So we're going to talk a little bit about PRO surveys. I'm going to use surveys, measures, questionnaires, instruments interchangeably. They all mean the same thing, okay? We're going to talk about the development of 3 symptom measures for PSC. I'll show some slides on patients' descriptions of fatigue, brain fog, and liver pain from one of our studies. Discordance between patient and doctor symptom reporting, and recommend using these PRO measures as communication tools with your doctors. And then I'll end with some other patient communication strategies that we've already touched upon today. All right, so, oops, look at that. Okay, so why have PRO measures become so important to patients? The picture on the left kind of shows you a little bit about this, but the doctor's looking at your labs and saying your labs are all normal, and they're really excited about that. And meanwhile, you are saying, I am in pain, I can't do the things I used to, I'm tired, I can't sleep. Your quality of life, it's not okay. So symptoms are subjective experiences, and we need to understand your symptoms directly from you. Normal labs doesn't always convert to a good quality of life. We also know that there's a poor correlation between clinical reporting and patient reporting of symptoms and side effects of treatment. So PRO measures, these are going to be very useful in PSC management and treatment. So many of you have probably participated in several, like through the registry, several survey studies. Very helpful for investigators and clinicians to understand what your experiences are when you're giving us this information. So this is just an example of one study where patients completed 3 different types of measures, and it helped us to understand, for example, that when your itch is getting worse, your quality of life is coming down, and with that, we have an increase in depression. So telling us that if we can manage your itch, quality of life might get better, and depression gets lower. These measures are also really important in our PSC drug trials for us to help measure treatment benefits and harms. Again, not just is your ALK Phos coming down, but how are you feeling? So this is an example here of we're using one of these studies used an itch patient-reported outcome measure, and you can see from baseline, week 3, 6, and 12, how itch came down in this study. So we can measure treatment benefits that are about how you feel and function as a result of a new medication. Treatment harms, we're also able to use patient-reported outcome measures to measure your adverse events in clinical trials. So the FDA is really trying to advocate for more patient-centered drug development. So not only can we use PRO measures to see whether you're having benefits, but we can also understand the adverse events or some of the safety signals from your perspective and not just from the provider's grading of your adverse events. Oops. And finally, in the healthcare system, and we'll talk about that in another minute. I'm going to back up a minute and just tell you a little bit about the goal of our PSC, our symptom assessment project. And there's probably even people in the room here or on virtually who have participated in this study. So PSC Partners has been funding us to conduct a project on designing 3 PRO measures to assess key symptoms that are most important to adults with PSC that are appropriate for use in research and in clinical trials to evaluate treatment benefits. And as you'll see in a minute, very patient-driven with a lot of patient engagement throughout this process. We had 3 aims of this study. The first thing we needed to do was to do in-depth interviews with patients with PSC to really understand your symptoms in depth and the impact that these symptoms have on your quality of life. With that information, moving into modifying or developing 3 symptom measures for PSC. And then after we have those measures developed, we have to do cognitive testing on them, again with another round of patients, to make sure that they are capturing your experiences, that they're clear and relevant to you. So in our screening for this project, we enrolled about 126 patients. Now, these were symptomatic. You had to be symptomatic in the past year. These were adults. But just giving you a sense of what we were, when we were doing a screening for the symptom, kind of the top 6 symptoms that come up. Fatigue in 83% of symptomatic patients, followed by anxiety, pain around the liver, brain fog, cognitive function, pruritus, and sleep, all prevalent in over 60% of patients. So with that information, we worked with PSC Partners and community advisors on figuring out what instruments do we need to develop that are not out there yet to be used in PSC clinical trials. How important is this symptom? Do we have a tool for it? And what's the likelihood of this being used in a clinical trial in the future? And so we came up with fatigue, brain fog, and liver pain. Now, itch is obviously very horrible symptom for many people, but we have a PRO measure for it. So in the Merriam studies, they're using an itch measure. So we went about developing for these 3 symptoms. So I'm just going to put up here, I'll pause for a minute, but these are illustrative quotes from our qualitative interviews with patients about fatigue. And you can see that patients, I have probably a 20-page, many more of these, 20 pages of illustrative quotes from patients describing their fatigue with PSC. So patients describing how frequent, how severe, how distressing, and how interfering. And so maybe these are some experiences that some of you that resonates with you. And then from the interviews on brain fog. And then on pain around the liver. We've discovered that patients talk about dull pain, a dull chronic achy pain. They also talk about a sharp stabbing pain. And I think that in some patients, liver pain seems to be liver pain, right upper quadrant, pain around the liver, but that area it seems to be more persistent or frequent than I think maybe most providers appreciate. We know it happens when we have a cholangitis attack, but a lot of patients are having this pain just a lot more frequently. It doesn't have to be within a cholangitis attack. So with that information, we then decided that those interview data helped us to decide on our measures. And so we have customized a fatigue measure, and we've customized a cognitive function measure. we're using the PROMIS item banks. And so this is, PROMIS stands for Patient Reported Outcome Measurement Institute. And these have been item banks and measures to questions to ask about fatigue, brain fog, and so forth. Developed by the NIH starting about 20 years ago, very reliable, valid, robust psychometric properties, a lot of evaluation. So I'll show you about that in a minute. And then there's not really a measure out there to get at liver pain, and so we developed a new measure for that. So this is just an example of the PROMIS item bank. There's 95 items, I know you can't read these, but 95 items in the item bank. So we're able to take the qualitative data that we learned from the interviews and then go into the item bank and find items that match and pull those items into a fatigue measure. So for example here, customizing this fatigue measure, we heard about weakness in the interviews. So bring in a question about weakness. We heard about sleep. We heard about frustration, exhaustion. So we're able to, match up items from the item bank with what we learned about from the interviews. And we did the same thing for cognitive functioning. We heard a lot about attention and concentration issues, processing speed, verbal fluency, working memory. And so again, went into the cognitive function database and were able to pull questions that captured these patient experiences. And then the liver pain measure, again, we are understanding two different types of pain. We've developed a measure. We are still evaluating this measure. But it may be that down the road there's going to be a treatment someday that maybe is going to be able to reduce some of that liver pain, but maybe it's going to reduce the dull ache, but not the sharp pain. And so we need to, at this point, we want to separate these two types of pain sensations with this measure. So we have our three measures. We then went from the interviews to the development of the measures, and now we have our measures, and they went through another 2 rounds with more patients with PSC to make sure that they were relevant, they're clear, that they capture everything that we've heard about. So we have these 3 measures, and I made a bunch of copies. They're out on the table out here for people that want to pick those up. So I want to move a little bit into using PRO measures in healthcare. So there's a lot of research showing discordance between patient and doctor symptom reporting. So generally, the research shows that providers report fewer symptoms of patients, lower severity than patients would, and we see this across many different diseases. We see this in clinical trials, and we see it in clinical care. The agreement, if you take a measure and you have a clinician fill it out for a patient and a patient fill it out, the correlation is only about 0.3 to 0.5. I'm going to show you just a couple examples of this. So this is one study. You can see here 6 symptoms. This is the cumulative incidence over 25 clinic visits of patient-reported fatigue, appetite loss, nausea, compared to clinician-reported. This is the incidence of moderate to severe symptoms. And you can see that the patients, we are identifying our symptoms earlier and more severe than the clinicians do. Here's another study, again, long list of symptoms on the left. For example, fatigue. The patients will report, 65% of them reported fatigue, and a very low, is that fatigue? Oh, that's pain at the injection site. Very low record from the clinician, and so forth. So there's discordance between the clinicians and the patients. And then finally, this is a study that we did a few years ago in patients with hepatitis C. So patients completed these 3 symptom measures: fatigue, headache, nausea. And you can see down the bottom, the severity is rated like normal, mild, moderate, severe. So when a patient said that they had severe fatigue, 69% of the time, that was not, that word of your fatigue was not captured in the medical record at all, even though it was moderate to severe. Only 31% of the time did the clinician actually mention it. And so we get a little bit more of clinicians mentioning your symptoms when it's moderate severe, when they're moderate severe, but not enough. So why does this happen? So symptoms, they are subjective, they're non-observable. Symptoms don't always correlate with your disease activity, that your doctors are taking a look at your labs and stuff. Symptoms may overlap with other conditions. There's often inadequate time to communicate about all of this. Typical clinical encounters are about 20 minutes, so there's a lot of information to get into that 20 minutes. And then so that your patient experience is not translated all the time into that clinical note. And this may have ramifications for you down the road. You could decide that you might need to be looking to apply for disability, or you might talk a lot to one provider at one clinic, and if that information is not in your note and you go to see another provider, none of that is in there. So it has ramifications. So we could use PRO measures to communicate a little bit better about our symptoms. Electronic PRO measures in your medical record. You can bring a hard copy of a PRO measure to the doctor visit. Research shows that when there is shared patient-clinician symptom review together in clinic, it helps clinicians start to align better with your experiences. And I do think that with AI, many of you are maybe seeing your doctors and you're noticing that they're asking permission to maybe record your encounter on their phone. That's being transcribed and uploaded to the medical record, and I do think that over time we're going to be able to see more of what's coming into your encounter, that you talk about in your encounter is actually going to make its way into your medical record. So we can use these PRO measures as communication tools with the doctors. We've developed a fatigue measure, a cognitive function measure. Again, we can complete these before clinic visits, or you can even upload these to your MyChart. Important when you're talking to your doctors, you want to think about different attributes of your symptoms. So we know that when you can describe to your doctor how frequent is it, how severe is it, how distressing, what does it impact? Is it impacting your ability to work? We tune in a little bit more when we hear that this is really having a big impact on aspects of your life. This measure here on the right, this was it's a measure that we've adapted with PSC partners. It actually lists 13 symptoms that could be associated with PSC. So you check what symptom you've had in the past week, and then if you've had it, you can check how often, how severe, and how distressing. And so bringing these to your doctors, they give a much better sense to, I think, start that communication with them about how you're feeling. These PROs are improving patient care and communication. On the left, we're already seeing kind of through your healthcare system or your provider, you may be getting asked to do surveys like a depression measure, an anxiety measure. When you're going to see primary care, it comes to you, you complete it, and they get that information. But we can also be reversing that order. We can take our measure. There is a way to attach measures like this to your medical record so that your doctor has it when you come into clinic to talk with them. These are just results from one study, not with PSC, but showing that when we are doing electronic PROs in your patient portal, you can, for example, do a survey checklist of issues that are going on. Those results come to staff. That message is sent to the provider, and then that provider is picking up the call, whether that is the dietitian or the social worker or the nurse, and they're calling you. So we have a quicker feedback loop when you are at home and symptomatic or having issues. These are ways that we can communicate more effectively with you. Okay, and I'm just going to wrap up here. These are evidence-based patient communication strategies that can help you with something we call shared decision making. And I think at the end of the day, that's kind of what we're looking for when we're showing up with our providers, this opportunity to kind of understand our choices, talk about our choices, and then we want to have decision talk, and we want to have pros and con talk. So Jen, this made me think of you because you tried to give your list of questions to the doctor and they kind of pushed it away, but do it again. So preparing these questions ahead of time, I wrote down 5 questions. We're the consumers, and we have 20 minutes with this disease expert. We need to get our questions answered, right? Number 2 is what we've just been talking about here, structured symptom reporting. We tend to be pretty bad if we try to talk about, what's been my fatigue in the past month. We are not as good as if we are kind of, keeping track of this on a weekly basis or something like that. So tracking symptoms using tools so that you can show up and talk to your doctor. And, my fatigue has been this bad for this long. They're going to listen to that. It might take you 5 minutes to describe the impact of fatigue on your life, but a form in front of them and they start seeing that, they're seeing words like severe and everyday, they're going to get it, right? We've talked a little bit about this, but this is called values clarification. I think the panel that we just had earlier was kind of getting to this, but clarifying for yourself your values and your priorities. So identifying and communicating what is important to you. Asking about options. It's options talk. Get all your options out there. There's a lot of options. Be explicit about asking for this. Discussing risks and benefits, your pros and cons. This is the kind of your options talk. What are the benefits and the side effects of these medications to me? Bringing a support person, so Jen always going with David to see the doctor, bringing somebody to help you remember. Research shows that, especially when we're anxious, we only retain about 25% of what the doctor told us when we're in clinic. 75% of it after that's kind of lost. Taking notes, asking to record. Can I record our conversation so that I can review this later with my care partner? So all of these very evidence-based ways to increase shared decision-making, talking with your doctors as your consultants, your disease experts, but they're there to guide you to make a decision based on your values and preferences. Take-home points. So these tools are used to communicate our subjective experiences. We've developed 3 measures for PSC specifically. We can use these measures in research, clinical trials, and in the healthcare setting. You're going to be seeing them being used more and more in healthcare, using them as communication tools to communicate your symptoms to your doctors, and other strategies that can help facilitate patient-provider communication and what we call shared decision-making. And then just a thank you to everybody, to PSC Partners for allowing us to do this great work, to my colleagues at Duke and UNC, especially Dr. Bryce Reeve. It's been fantastic to work with. All of the patients, maybe here or online, who have contacted us to participate in the symptom assessment project. And we had a really great community advisory board working with us through this project. Thank you.